Assalamualaikum and good day everyone. My name is Muhammad ZAFFAN bin ZALI. So today all of us would like to present about EBE1053 Principle of Economics Megah Holding Group for group assignment. In this slide we can see part 1 and part 2. For the second thing meets the themes a little bit about our background and lastly reference. So meet the team. My name is Muhammad Zaffan bin Zali. I'm the group leader. Next.
Hi, my name is EKLYSIA.
Hi, my name is NURUL NABILAH binti AMIR.
Hi, my name is HUMMAIRAH HASSANAH binti HASSAN.
So we continue for the part 1, 1.0, type of market structure industry and explanation for the characteristic of market structure industry. Explanation. The healthcare industry consists of both private and public providers and is characterized as a mixed oligopoly where a few large private hospital groups and insurers dominate the marketplace. While substantial public healthcare provision exists, when evaluating potential merge between private healthcare providers, regulators cannot simply assume all players aim to maximize profit. They must account for complex interaction with public entities focused more on consumers' welfare and inclined to expand capacity if undeserved need emerge. Public providers may react differently than private firms to market structure change due to broader access goals. Ignoring these dynamics risks incorrectly assessing whether a healthcare merge will ultimately harm consumers. Regulators need more nuanced merge analysis reflecting mixed incentive in order to properly determine the full impact of consolidation in the complex public-private healthcare marketplace. Next.
Part 1, 2.0, explanation of the price behavior and the social cost of the market structure. Next. The healthcare industry exhibits characteristics of an oligopolistic market, where a few dominant private providers can collude to fix prices at profit-maximizing levels, illustrated by a monopoly-style demand curve. Prices are influenced by underlying cost of services and insurance coverage dynamics like risk pooling and cost distribution across large insured populations which impact overall demand. While theoretical economic models predict pricing behavior in oligopolies, real-world healthcare pricing is complicated by regulated players like Medicare and Medicaid. Patent expiration enabling generic competition, economics of scale benefits for larger producers, and most importantly, differences across healthcare systems and national market structures. Ultimately, effective pricing, control, and management in healthcare markets is crucial but challenging due to complex incentives and demands between public and private players across the health system value chain.
For the next one, part 1, 3.0, discussion about the government policies that affect the growth of the industry. Government policy, we have two, which is the subsidy and incentive. For the subsidy, in terms of demand side policies, the government has introduced various healthcare subsidies and financial assistance programs to improve affordability for lower income Malaysian patients. For example, the Peduli Kesihatan initiative provides subsidized healthcare service and free medical treatment to the B40 income group. Such affordability initiatives have brought small Malaysians into healthcare consumers pools, expanding the revenue base for providers. The second one, incentive. The government has also rolled out grants, funds, and incentives aimed at spurring growth in priority healthcare industries such as medical device manufacturing. This nurturing of the medical device ecosystem has led to significant investment by local and global medtech firms to establish Malaysian operations. In essence, strategic government policies aimed at healthcare, financing subsidization, privatization, infrastructure development, and industry promotion have been the key drivers catalyzing robust investment and growth in Malaysia healthcare sector over the past few decades. Next, part 2.
So we move to the next part 2 1.0 draft discussion and comparison of the business cycle of the real gross domestic product for Malaysia and Singapore. Next. So we can see in this slide, gross domestic product Malaysia and Singapore from 1980 until 2022. The Grim 2 above show gross domestic product GDP per capita Malaysia and Singapore from 1980 until 2022. Basically, in 1980, GDP Malaysia is 1.61 billion US dollar, while GDP from Singapore is 4.38 billion US dollar higher than Malaysia. Secondly, in 2001, GDP for Singapore is 5.28 billion US dollars, still higher than Malaysia, 1.9 billion US dollar. Lastly, comparison GDP Malaysia and Singapore in 2022. In 2022, Malaysia recorded 1.52 billion US dollar, lower than Singapore, 5.53 billion US dollar. Next.
For part 2, 2.0, explanation about how Singapore GDP can be higher than Malaysia despite Singapore having a significantly lower population. According to the result of GDP, next, according to the result of the online search, Singapore GDP has always outperformed Malaysia GDP. It is because Singapore economy outpaced Malaysia economy by producing a higher quantity of goods and services. However, having a far lower population, Singapore managed a higher real GDP than Malaysia. Because of this, high GDP per capita, which is measures a country's average income per individual. GDP per capita is calculated by dividing total GDP by population size. Next, according to the result of search on the internet, Singapore GDP per capita in 2022 will be 5.5 billion US dollar, whereas Malaysia GDP per capita will be 1.5 billion US dollar. As a result, Singaporeans had a much higher standard of a living and purchasing capacity than their Malaysia counterparts. Singapore has surpassed Malaysia in terms of GDP growth for a variety of reasons. It is critical to note that these variables are complex and linked, and no single factor can fully explain the difference in GDP growth between the two countries.
I think that's all for our group discussion for EBE 1053 for today. That's all. Thank you very much.